Hi, my name is Nicole Stoecken, and I am a pediatrician at the MercyOne Grimes Pediatric Clinic. I'm also a mother of 4. As we head into fall and October, of course, fall brings fun new changes with changing climate. It also brings a great opportunity to advocate on many important things, such as breast cancer, Down syndrome awareness, domestic violence, and then what we're going to talk about today, which is SIDS Awareness Month. As a pediatrician, from day one, when I meet a newborn in a new expectant family, we always talk about safe sleep and the importance of that. SIDS is one category of something that you maybe not have heard of before, which is SUID, which is a sudden, unexpected infant death. Infant, in this scenario, is defined as a child less than the age of 1 year. Within SUID, we look at SIDS, but also unexpected deaths due from suffocation, entrapment, as well as other causes. Per the CDC, every year in the United States, over 3,500 babies die unexpectedly. Here in Iowa, our current SUID rate is about 90.4 per 100,000 babies. In Iowa, each year, we have an average of 38 to 40,000 babies born, which means roughly 36 babies will die each year in our state due to an unexpected death. Luckily, since the 1990s, the rates of SIDS have been declining with the introduction of the Back to Sleep campaign. The campaign has now continued under Safe to Sleep, but the levels of the rate of decline have slowed, and we want to make sure we're working to continue to decrease that number. In 2016, the American Academy of Pediatrics passed some sleep guidelines and recommendations, and I'd like to share some of those main recommendations with you today to hopefully offer you some SIDS risk reduction. One of the big things we know we can do for infants and babies is always put them to sleep on their backs. We want every baby laying supine or on their back until the age of 1 year. Studies have shown when infants are placed on their back, there is no risk of increased choking or suffocation should they have a regurgitation event. We know that babies sleeping prone or on their tummy actually increases those risks, and especially increases those risks for babies who are born early or at a low birth weight. We also know that using a firm sleep surface is very important in the risk reduction for SIDS. We always want babies sleeping on a firm, flat mattress that fits appropriately in their sleep space, whether it's a crib, pack and play, or bassinet. We want that crib mattress to be fitted with a fitted crib sheet, and then as I explain to my families, I like that sleep space, I'll empty sad depressing. No blankets, no pillows, no teddy bears, no crib liners or bumper pads, just your baby laying on their back all by themselves. We also do not recommend babies be placed in an adult bed due to the risk of suffocation or entrapment. The American Academy of Pediatrics always recommends breastfeeding as the primary nutritional intake for babies when possible. We know that breastfeeding reduces the risk of SIDS, especially when done exclusively for the first 6 months of life. Another topic we like to discuss is something called room sharing. Many of us have heard the terms co-sleeping, which I like to avoid because I think it's confusing. The American Academy of Pediatrics actually recommends an infant room share, meaning they are in the same bedroom as their parents, but in a separate sleep space, such as a bedside bassinet or crib. We do not recommend babies bed share or actually sleep in the same sleep space as an adult. We always recommend all infants and babies follow the CDC and American Academy of Pediatric recommendations for vaccinations and immunizations. And then we know there are some other basic strategies to decrease the risk of SIDS. We recommend babies use wearable sleep sacks or tight swaddles. We want to avoid overheating of babies. As a general rule, we do not recommend babies be in more than one layer of light clothing than an adult in a similar environment. There have been shown to be protective effects of pacifiers. Even for a baby who the pacifier falls out after going to sleep, there is still added protection with its use. We always recommend avoidance of passive smoke exposure, both during mom's pregnancy as well as after a baby is born, and then also decreasing exposure to alcohol or illicit drug use by the parents and in the home. As you prepare to welcome your new little one into the home, I thought I'd review some products that are available on the market, but maybe not recommended from a pediatrician standpoint due to the risk of SIDS. We always avoid the use of wedges or crib positioners or baby positioners. Crib wedges elevate the baby, and we risk that they will kind of roll to the bottom of the bed, and then we have a potential for suffocation or entrapment. Different positioners that have been popular over the years. There used to be rock and plays. Some parents, talk about having their baby sleep in a car seat or a baby swing. The concern with those devices is babies can tuck their heads, and now we have a risk of death due to positional asphyxia. There are newer products on the market, such as sleep mats or a DockATot. Those are not recommended for an approved sleep space until after the age of 1 year as well. My hope going forward is this helps guide you with some approved sleep and sleep recommendations to keep your little ones safe. Of course, we always hope you are asking questions to your patient or your baby's provider going forward. I hope this has helped give you some guidance and some recommendations to help with safe sleep for your child in your home. I, of course, always encourage parents to continue to have these discussions with their baby's pediatrician going forward. Our hope is to continue to raise awareness of safe sleep guidelines so that we can see these rates of unexpected death continue to decrease over the years. Congratulations on your new little one, and welcome to a great life adventure.